Hello, welcome to Moz Nutrition Health Educator Series. My name is John Sherman and I'm presenting today our first informational video. We'll be talking today on a favorite topic of mine. It's biorhythms, and they're also called circadian misalignments and arrhythmias of life that affect our bodies day to day and change how we feel, the effects of our hormones, how we deal with the outside world. Very fascinating. I was reminded of these concepts last week. I was advising a practitioner in dealing with a patient who had endometriosis, and the woman had been put on a birth control pill throughout her entire cycle, so she would never menstruate. And we were talking about the repercussions of this. And of course, in functional medicine, this would be a real issue because we know that a normal physiology would need to go through the full cycle. And when we extrapolate on this concept, biorhythms should be taken into account when prescribing also. Throughout history, medicine has tried to interpret and more accurately describe these various biorhythms, so no matter what you're using, whether it's a medication or a supplement, you'll be able to intervene in an appropriate manner. One of the first presenters of biorhythm information was a botanist by the name of Linné in Sweden in the early 1700s. And he described a clock of various flowers where he actually witnessed the flowers opening and closing throughout the day based on the amount of light, and he could tell the time by how open the flowers were. Very fascinating. So, of course, for functional medicine practitioners, this is an old concept, but not well understood, and there's more and more research coming out showing the effects of these things. Most of us know about adrenal rhythm, thyroid rhythms, of course ovarian hormone rhythms, sleep patterns, light rhythms. These are all very important, and I want to describe a couple of other rhythms that you might not be aware of. One is the sympathetic parasympathetic system. And of course with adrenal function, we all know that the adrenals start elevating the hormones early in the morning at 4 a.m. perhaps, and then waning around 4 p.m. And that's when the thyroid hormones kick in. So the thyroid hormones peak about 8 p.m. and that's where our temperature is at its highest throughout the day. So that's our continuity of energy throughout the day. The sympathetic parasympathetic system, of course, the sympathetic system is heavily influenced by the adrenal glands throughout the day. So when we're prescribing our adrenal support, of course, when we're trying to upregulate the adrenals, we want to dose the adrenal supplement during that time, especially early in the morning. We don't necessarily want to give any adrenal stimulus late at night, which could keep the patient up. And a lot of course, patients with insomnia have high adrenal hormones in the evening or during the night, which throws off their whole cycle. Same with the thyroid. I have my patients take their thyroid support early in the evening versus first thing in the morning, because that is the thyroid time of day. That's when the thyroid is maximizing its hormone production. Another biorhythm that you may not be aware of is what I call the anabolic-catabolic rhythm. We spend about 12 hours a day in both. The catabolic happens early in the morning, and catabolic basically means breaking down, discharging, cleansing, detoxing. The anabolic part of our cycle, our daily cycle, happens later in the afternoon and early in the evening. Catabolic happens when we're much more active, we're using up nutrients, where circulation is stronger. It's the best time to practice also, to exercise. And the anabolic phase is where we take the nutrients that we've absorbed through the day and we sleep, and our cells absorb a lot of nutrients for rejuvenation at that time. So working with this issue, one of the recent articles that I discovered was a study that was done on high blood pressure and when the medications were prescribed. For example, they found that ACE inhibitors given early in the evening actually worked better throughout the 24-hour period rather than taking the medication first thing in the morning. When taken first thing in the morning during the catabolic phase, it basically just worked during the daylight hours, whereas taken at night, it worked through the whole clock. Another fascinating study was found by measuring the amount of melatonin in various individuals, and it was discovered that people in various populations, for example, blind people, late night workers, shift workers, flight personnel, people who lived in the Arctic, they all seem to have a higher risk, cancer risk, and it was determined that these people, of course, have less melatonin production. And the theory is that melatonin is something that can help prevent risk of cancer. Another interesting study that was found measuring the amount of inflammation in the body. They measured various women, and interestingly, they checked breast temperature throughout the cycle, the ovarian cycle, and found that there was a specific temperature rhythm throughout the 28-day cycle. When they found women who had fibrocystic disease or say breast surgery, cancer, these women tended to have a shift in their breast temperature, which would be a change of 1 to 2 days. So the actual level of inflammation changed the temperature of the breast itself. Another interesting study found that women with breast cancer where the axillary lymph nodes were removed, they found there was much less mortality based on the women that had lymph nodes removed during the progesterone phase of their cycle. So in other words, when the lymph nodes were removed during the luteal phase, there was much less risk of metastasis versus during the estrogen phase or follicular phase. And the last study I wanted to tell you about was one that is based on bone mineral turnover. They did a study with various folks. There were about 28 people over 70, 14 men, 14 women. And they measured the amount of bone turnover metabolites within the blood from morning and evening. And they found as much as a 40% change in levels of osteocalcin and parathormone and even urinary collagen teleopeptides. So these variations from the mean showed a very important way of standardizing these laboratory tests. So it really results in the fact that the variation in laboratory tests can be pretty dramatic depending on what time of day it is. And as we learn more and more about these biorhythms, we'll be able to tell exactly when the human biological clock is performing, and we can base our functional medicine approach much more accurately and more long-term. Thank you for listening, and this is John Sherman for Moss Nutrition. Until next time.